Presentation. Now we will give the floor to Assistant Professor Mesrur Selcuk Silay, Pediatric Urologist, Bezmialem Vakif University, Faculty of Medicine, Division of Pediatric Urology from Istanbul, Turkey, representing the Muslim community. And I would like to ask once again all the experts to respect the time, since the time is very limited.
Dear Chairman, dear participants, male circumcision is one of the oldest surgical procedures in history. Approximately, it's not working. One-third of the whole men in the world are being circumcised, and the total number estimated is to be 1.2 billion. Of course, those numbers are subject to change, but the reality is that it's being performed in all over the world and in all of the religions and cultures. We all together watched a video about the male circumcision, which is performed in non-sterile conditions. However, the #1 rule of the scientific truth is that personal experiences cannot be generalized. How can you adopt this video into 1.2 billion men? Is this fair? Is this scientific? No, it's not. This is a traditional circumcision party in Istanbul. Here you can see the children are very happy wearing fancy clothes and dancing with the traditional Turkish music. But today I'm not going to talk about the personal experiences. Instead, I'm going to talk about the evidence-based medicine. What does the evidence-based medicine say? They only respect the meta-analysis of randomized trials. And all of the examples I'm going to give today are from the meta-analysis. Here we can see that if you are not being circumcised, you have almost 30% chance of having urinary tract infection. It's obvious. If you are not being circumcised, you have a 22-fold of having a penile cancer over your lifetime. It's also been proven. And if you are not circumcised, you have a very higher risk of having sexual transmitted diseases. It's also obvious, and the results are robust. There is also very strong data about AIDS. We also see that up to 66% of protection can be covered by having a male circumcision. Cannot be underestimated. The benefits cannot be underestimated. Did you know that 0.5% of the uncircumcised men require medical attention over their lifetime? Is this a small proportion? Think about it. Does male circumcision adversely affect sexual functions? No, it's not. There are several trials showing that it does not negatively affect. Is it a painful surgery? No, it's not. Under appropriate conditions with local or general anesthesia, it does not cause pain. Is it cost effective? Yes, it is. Did you know that if you decrease 10% of male circumcisions, you will have a loss of more than 400 euros. So it's also very good for the health communities. So is it affecting the psychological functions? No, it's not. There is no systematic review and meta-analysis on the subject, and the comments are only subjective. American Academy of Pediatrics are commenting on this issue frequently. Let's have a look at it. In 1975, they said that there is no need for routine neonatal circumcision. When we come to 1989, they say that there are potential benefits because the benefits are increased, evidence is increased. In 1999, they say that there is sufficient evidence. And finally, they say that the health benefits of newborn male circumcision outweigh the risks, and they suggest circumcision without any doubt. So what I can say in this evidence, with the growing evidence in favor of male circumcision, we can see that it's very beneficial. I would like to come to the report. It's been said that male circumcision has serious consequences for the health and well-being of the boys. Under those evidence-based medicine, this has been cancelled. The male benefits of male circumcision on health is obvious and clear. It's now approved. I'm asking to all of you, are we still going to play three monkeys, or we are going to trust the evidence-based medicine? There are a lot of misleadings and biases of the rapporteur that it's very hard to tell you in this limited time. But the majority of the given references are from non-randomized studies and the low-quality scientific articles or from personal experiences. It's been said that this procedure is increasingly questioned. No, it's not. Instead, there is an increasing evidence on its benefits. It's been said that 100 circumcisions are needed to prevent a single infection. This was true in 2005, but last year an article published, a meta-analysis showed that only 4 circumcisions are needed to prevent one infection. Now I would like to ask you one question. Why are we talking circumcision, but not vaccinations or tonsillectomy? They also have similar complications or more complications than circumcision. But the meta-analysis of tonsillectomy have shown that it has no significant effect on the children's health. But we are talking about circumcision. Does it have a religious context behind? We have to ask this question to ourselves, and we have to be honest. Another error, we can increase all of the errors, but about the HIV infections, it's been said that it's not scientific. I'm showing you this map. In the circled areas, the circumcision is rarely performed. And within the same areas, here you can see that the AIDS prevalence is very high. It's been said that it's the dark side of our own religion. No, it's not. It can only make proud. Again, this video, it's a very bad example, and it cannot be generalized into 1.2 billion circumcision. It's not scientific, and it's not fair. The suggestion of solution was performance of circumcision after 14. There are several risks of doing it. The complication rates are higher, economic costs are higher, protection against UTI and STI are lost or delayed. Most importantly, an adult cannot consent to his own infant circumcision. The time already passed by. An English proverb saying that a stitch in time saves 9. Our suggestion of solution is increasing the standards of circumcision in Europe, encouraging the neonatal circumcision, increasing the awareness in health, and experienced doctors should perform it. I can show the example of Turkey. Now the Turkish Ministry of Health just decided that this procedure can only be performed by medical doctors after next year. Finally, my last slide, we can cheat on ourselves, but we cannot cheat on the scientific truth. Thank you very much.
Thank you, Professor Silay, for your presentation. And now